Breast cancer is a disease that begins when cells in the breast tissue start to grow abnormally. Instead of following the body's natural cycle of growth and repair, these cells multiply uncontrollably, eventually forming a lump or tumor. While it is one of the most common cancers in women across the world, it's important to remember that men can also be affected, though far less frequently. The cancer can develop in different parts of the breast, such as the ducts that carry milk to the nipple or the lobules that produce milk, and in rare cases, in the connective tissue that supports the breast. On a global scale, breast cancer represents a significant health challenge. According to the World Health Organization, it is the most frequently diagnosed cancer among women, with an estimated 2.3 million new cases reported in 2020 alone. This means that more than 1 in every 10 new cancer diagnoses in women worldwide is breast cancer. In the United States, it stands as the second most common cancer in women, just behind skin cancer. Statistics show that approximately 1 in 8 women in the US will face a breast cancer diagnosis at some point in their lifetime. For 2023, the American Cancer Society projected nearly 298,000 new cases of invasive breast cancer in women, along with over 55,000 cases of non-invasive forms. Even though it is far rarer in men, about 2,800 new cases are expected annually. Breast tissue is made up of several distinct cell types, and cancer can arise from any of them. The ductal cells line the milk ducts, transporting milk from the lobules to the nipple. The lobular cells make up the lobules themselves, where milk is produced. Then there's the connective tissue, which provides structure and support. Most breast cancers develop in the ducts or lobules, while cases originating in the connective tissue are uncommon. Although the exact cause of breast cancer is not completely understood, several risk factors have been identified. Age is one of the most significant, with most diagnoses occurring in women over the age of 50. Being female is itself a major factor, as breast cancer is far more common in women than men. A family history of breast cancer, particularly if a close relative such as a mother, sister, or daughter has had the disease, increases the risk. Certain inherited genetic mutations, most notably in the BRCA1 and BRCA2 genes, can greatly raise the likelihood of developing the condition. Hormonal influences also play a role. Prolonged exposure to high levels of estrogen and progesterone, such as from early menstruation, late menopause, or hormone replacement therapy, can increase risk. Lifestyle choices, including poor diet, lack of exercise, smoking, and regular alcohol consumption, have also been linked to higher rates of breast cancer. Once breast cancer begins, it can spread beyond the breast tissue. It may first move into nearby lymph nodes and then to other parts of the body through the bloodstream or lymphatic system, a process called metastasis. This spread often makes the disease more challenging to treat. Breast cancer doesn't always cause symptoms in its early stages, but when it does, the most common sign is a lump or mass in the breast. These lumps often feel hard and fixed in place and may or may not be painful. Some people experience tenderness or discomfort in the breast, changes in size or shape, or differences in appearance between the two breasts. Nipple discharge, particularly if it is bloody, can be a warning sign. Skin changes, such as redness, dimpling, or puckering, should also be taken seriously. Because some breast cancers develop without noticeable symptoms, regular screening through mammograms is essential for early detection. There are several forms of breast cancer, each with unique characteristics. Ductal carcinoma in situ, or DCIS, starts in the milk ducts and has not yet invaded surrounding tissue, making it non-invasive and highly treatable when detected early. Invasive ductal carcinoma, or IDC, is the most common form, beginning in the milk ducts and spreading into nearby tissue, with the potential to metastasize if untreated. Invasive lobular carcinoma, or ILC, starts in the lobules and can also spread beyond them. Triple-negative breast cancer lacks 3 common markers: estrogen receptor, progesterone receptor, and HER2 protein, which often makes it more aggressive and typically requires chemotherapy. HER2-positive breast cancer, on the other hand, is driven by the HER2 protein, which fuels cancer cell growth but can be treated with targeted drugs designed to block this protein. Inflammatory breast cancer, though rare, is an aggressive form that causes the breast to appear red, swollen, and warm, often resembling an infection. It requires urgent treatment and can be challenging to manage. Diagnosis involves multiple steps. A physical examination may be followed by imaging tests like mammograms, ultrasounds, or MRIs, which can reveal tumors not felt during an exam. If abnormalities are detected, a biopsy is performed to confirm whether the cells are cancerous. Staging tests such as CT scans or PET scans help determine how far the cancer has spread, which is crucial for selecting the most effective treatment plan. Early detection through screening is one of the most powerful tools for improving survival rates. Treatment options vary depending on the type, stage, and individual patient factors. Surgery is often the first step, with two main approaches. A lumpectomy removes only the tumor and a small amount of surrounding tissue, aiming to preserve as much of the breast as possible. This is typically followed by radiation therapy to ensure no cancer cells remain. A mastectomy removes the entire breast and sometimes nearby lymph nodes, and may be chosen for larger or more aggressive cancers. Radiation therapy uses high energy beams to destroy cancer cells, either after surgery or as a primary treatment when surgery isn't possible. Chemotherapy employs powerful drugs to target cancer cells throughout the body and is often used when the cancer is more advanced or has spread. Hormone therapy is prescribed for cancers that are sensitive to estrogen or progesterone, blocking or reducing these hormones to slow cancer growth. Targeted therapy focuses on specific molecules that cancer cells need to survive and grow, such as the HER2 protein, offering a more precise approach with potentially fewer side effects. In many cases, a combination of these treatments is used to achieve the best results. Each plan is tailored to the patient, and it can be adjusted as the cancer responds to treatment or as new therapies become available. The fight against breast cancer is one that blends medical science with personal resilience, and advances in detection and treatment have already saved countless lives. Regular screening, awareness of symptoms, and prompt medical attention remain the cornerstones of improving outcomes and moving closer to a world where breast cancer is no longer a leading threat to women's health.